So good afternoon. I want to make two comments before I begin. The first is, even though I have sort of the time slot of death, you never want to be the last speaker in a sort of long day. I am talking about sports, so that should offset, my strangely soothing voice and your postprandial somnolence. And another point I wanted to make is I had no idea the nostril would be quite so big on this title slide. But I'm very glad that John's not sitting here any longer, so he looks snotty and all that. So I have three goals today. I'm gonna talk about three things, and the first is just how one assesses visual function in athletes, the kind of challenges that you have when thinking about visual performance in people who do sports. The second is what do we mean by visual performance? For example, we all know very clearly that macular pigment affects visual function. After all, the last talk was about how to assess macular pigment using psychophysical methods, for example, color matching and flicker photometry and motion photometry, and you can do it with absolute thresholds, all these behavioral methods. So there's no doubt that macular pigment affects visual function in a very linear manner, given the right stimuli. The real question is, does that matter in an ecological sense? Or did the mechanisms that evolved for macular pigment accumulate there because we knew we were going to measure macular pigment psychophysically someday? Probably has some ecological effect that we can assess. And also, of course, it didn't evolve to do two other things: probably prevent AMD, which is a disease we get very, very late in life, and to make you not need glasses. I doubt very much that we were on the savannah going, is that like a lion? It'd just eat you and you wouldn't evolve and pass on your genes and all that business. So it probably affects visual function early in life in a way that was relevant to outdoors. So we'll talk about that a bit. The last is basically nutrition in athletes. In many ways, athletes represent a special population in the sense that they expend an enormous amount of calories every day. They can easily work off 5,000 or 10,000 calories a day. They're a very active group. So consequently, they ironically enough, tend to be somewhat nutritionally deprived. They can get away with drinking a gallon of Coke a day and not get heavy. That's why often when you see these football players and such, when they retire, they immediately gain a whole lot of weight because they're used to just this enormous caloric intake and eating not optimal foods, as it were. So they're strangely nutritionally deprived, even though they look so fit. So we'll talk about those three things. The first thing, and this is certainly something that we've seen in our study of athletes and other people have seen, and that is, as a group, at least in terms of refractive condition, they have very, very good vision. So if you assess most athletes, like this was a study that was done in the Dodgers, a baseball team, and about 80% of them had vision that was better than 2015. So in fact, a very significant number of them had vision that was about 28, which is about as good as one can get from a refractive sense. So as a group, most athletes have very good acuity. And that's probably self-selection. There's a sort of cascading effect of good vision. So if you're young and you have poor vision, you'll probably become an optometrist or something. But if you have very, very good vision, then you do better in sports right away, and then you stay in sports, and then you become professional in sports. So there's that self-selective factor. So as a group, they tend to have very, very good vision. There's a little school of thought that if you make it even sort of super refractive, if you take people with 20/20 vision and can get it down to, say, 20/10, which you can sometimes with LASIK or various other means, that there might be some advantage to that. But as a group, they don't need a lot of spectacle correction usually. However, what tends to limit their vision are the very things that have limited our vision through most of our history. And that is the things you encounter outdoors. So you encounter bright sunlight and scattering within the eye, and they have to have very fast visual processing speeds and photostress recoveries and things that are just normal to vision outdoors. So there's a reason, for example, that that baseball players wear baseball caps with, the brim protects them from sunlight, or why a lot of athletes wear eye black, that black that goes right under their eyes, because they get a lot of reflection from their cheeks in their eyes that impair their vision. And so these are factors that one has to consider when they're measuring visual performance. And here's a good example. If you watch baseball players, and I tried to magnify this a bit, because what happens when you pitch a ball at 90 miles an hour is every single pitch is sort of optimized visual motor performance. If you could look at this guy's face close up, he's going, because he's just peaked out in every sense to get a ball that fast at that specific of an aim. So when they throw it and given an 80, 90 mile an hour pitch going 60 feet, it gets to the batter's plate in less than half a second. So remember that it takes about 500 milliseconds for something to even be visually perceived. So in order for it to be consciously seen, it takes 500 milliseconds. So they actually have to hit the ball before they actually see the ball. That's how fast it has to be. In fact, they're making most of their decision within about 100 milliseconds. So it's super fast. And vision, of course, is just super fast. There's a reason why demyelinating diseases affect the optic nerve so early on. It's just a very myelinated nerve. And remember that myelin is what speeds up neural conduction rates. So vision has to be extremely fast. You can't go, you have to react visually, before you consciously perceive things. So vision can be super fast. So with a lot of sports, just a small threshold change can translate to fairly large improvements on the field. Hence why a lot of athletes are interested in improving their visual motor performance. And if you look at a lot of the more famous athletes over time, they were sort of infamously known to have extremely fast vision. So Ted Williams was one of the more famous baseball players. And he had a batting average of about 0.4. And what that means, it doesn't sound all that impressive, but about 4 balls out of 10 he could hit, which is an extremely good batting average. But he was well known to be able to read records. By the way, let me express right now that I'm sad that my kids would not know what I'm saying when I talk about records, and that they used to spin around and things. But he could read records as they were playing. He could read the labels of the records because he was known to just have super fast vision. So these are all considerations in visual performance of athletes. Consequently, by the way, there has grown a market to supplement to those needs. So there are sports supplements that promise those very benefits. So vision accelerators and sharpens focus, heightens contrast, see it sooner. Here's another one, see better, react faster. And these are supplements that are largely lutein and zeaxanthin, based on the idea that they can sort of accelerate your vision, help vision outdoors. So what I thought I'd do now is just go over the evidence for this. One source of evidence has always been the fact of anatomical placement. We know, for example, that carotenoids in foods go very selectively and kind of funneled into the macula of the eye. However, they're not just in the macula of the eye. They're throughout ocular tissue. They're for example, in the epithelium of the lens. And we have data that more carotenoid in the lens is linked to a clearer lens. So that obviously benefits visual function. We know that it's throughout the retina. So it's in the macula, but it's also in the RPE. It's even in iris tissue. It's throughout ocular tissues. In fact, it's even in the fat around the eye. The fat around the eye is a little yellow because of the carotenoids surrounding the orbit. In addition, we know it's in some very key locations in the brain. This is research that's just starting. And we know, by the way, that measurements within the retina are very strongly correlated to amounts in the brain. So if you do anatomical sections of the macula and measure the carotenoid there, and then measure amounts in the visual cortex, in primate models, the correlation is about 0.9, very, very high. Now we have some human data that support this that'll be shown later in the conference. The measurements in the eye reflect amounts in the brain. And in the brain, it's in some real spots. It's in the cerebellum, which is the area of the brain that's responsible for muscular coordination, equilibrium, those things important to athletes. It's in the frontal cortex. It's in the hippocampus. That's the big information processor in the brain. So it seems to be really strategically related or strategically positioned throughout the visual system. It has been known for a long time that intraocular yellow filters affect visual function across species. In fact, as early as the 30s, there were papers just that remarked on the ubiquity of intraocular yellow filters. And they weren't pink filters or red filters. They were invariably largely yellow. So the idea was, well, why do all these species have yellow filters within their eye? And how do you get away from that sort of luminance versus acuity problem? Usually, of course, light is the stimulus for vision. So how could it be that reducing light could ever be a good thing? And so people wondered about that. And so some of the things that were picked out very early were things like glare and dazzle. Obviously, too much light's a bad thing because it scatters in the eye, impairs vision in lots of ways. One thing that's been known for a long time is that our planet is very blue. So if you go out into space, we look like like a blue marble because of so much Rayleigh scattered light. So yellow filters look yellow because they transmit midwave and long light, and blue because they absorb blue light. So that's probably not a coincidence. Also, chromatic contrast. That's the third one I'll talk to you guys. So let's start off with glare and dazzle. One of the early studies in this area was done by Jim Stringham from our lab. And he looked at glare discomfort and photophobia. One thing that's very obvious about light is that it can be kind of uncomfortable, especially depending on your adaptive state. So it doesn't take a lot of light to be uncomfortable. If you're fully dark adapted and you open the refrigerator at night, that can be quite blinding, actually. So it's useful sometimes, or it was thought to be useful, to reduce that photophobic component. So one of the first studies that Jim did was to measure the photophobia threshold. So what he did is he used the squint response. He'd flash people with very bright lights and then measure their EMG response, so the EMG recording of their squint. And he found that shortwave light had an enhanced squint response, which, when you think about it, was probably somewhat protective. It's probably good to look away or squint when you're faced with very actinic light. Then in the next series of studies, he measured these photophobia thresholds and then the amount of macular pigment in the eye and found very strong relations between the two. Another study, they supplemented lutein and zeaxanthin for several weeks and then looked at the change in these photophobia thresholds and found that as lutein and zeaxanthin went up in the retina, photophobia thresholds went down. So that was good evidence that it reduces this glare discomfort. In addition to glare discomfort, we also have issues with glare disability, the disabling effects of light. And again, this is a real big issue in sports. I mean, sports are played outdoors. So they're often looking into the sky and catching balls, and that's why, especially baseball, they're so geared to that, and rims and eye black, and even some of the gloves are designed so that you can actually look through the glove to see the stimulus. That's why they have that mesh net in the back, so you can kind of see through them. They're designed that way on purpose to reduce the effects of glare. And even at night, they use these very intense bulbs, by the way, xenon bulbs, which almost perfectly match sunlight. If you measure the spectral output of the lights that they use in stadiums at night, they perfectly match the sun, and they light them up like it's day. So glare is a big issue for a lot of athletes. And of course, what causes both glare and glare discomfort is the fact that when intense light enters the eye, it scatters and degrades a visual image. So to get a nice crisp image, you need to have a very clear optical media that's not scattered, excessively scattered in the anterior portion of the eye. And of course, the older you get, the harder that is to get. The one challenge of the eye is it has to create biological tissues that are completely invisible. It's sort of like the Harry Potter invisibility cloak. How do you make a tissue that's transparent to visible light? So, imagine you can't have a lens in the front of your eye that has organelles and all the other light-absorbing elements that most cells have. So in the embryological development of the eye, that's all squished out, and you just have the crystalline proteins that remain. And that is one reason why, by the way, the lens is the only biological tissue that doesn't undergo renewal. In the rest of the body, if you lose a cell, it's just replaced by another cell. But that's not the case in the lens. These are the cells that you're born with. And they keep adding cells on the outside. And so and that's one reason why presbyopia occurs, right? So you add all these cells on the outside, but there's not a lot of room here to get bigger. So the cells, the tissue just gets more compact and less flexible until you need reading glasses in your 40s or 50s. The other challenge, though, is it has to stay clear. And what happens is this crystalline lattice becomes disordered, and that will cause inhomogeneities, cause scatter issues. Another thing, by the way, that causes some scatter issues is correction for myopia. If you do LASIK or some of these, you make imperfections in the cornea. That also has to stay very optically pure. So when you take the little scalpel and you cut out the outer portion of the cornea, you're creating a big inhomogeneity there, which creates a lot of scatter from the sides. So you get more and more scatter as you get older. You get more vitreal scatter. So you have your floaters, muscae dilettante, right, and your vitreous. And that's, your vitreous is there for life. So any sort of debris that's generated by your retina can just float in there. That's when you start seeing the floaters on bright days like today. And those just get worse and worse over time. Even your hyaloid artery from your optic nerve breaks apart at birth and floats in there. So the more of that just all causes scatter within the media and glare disability, which can be dramatically different in even young people when you measure these variables. And, of course, outside of the world of sports, it's just a functional problem. Probably the biggest source of accidents is glare from the sun and glare from other headlights. So glare is a big issue. And it's sort of easy, I guess, to see how glare can impair vision even on a sunny day. It reduces contrast. So, for example, if you have a lot of light going in your eye, you probably wouldn't see this little girl coming out from behind this car. This sort of masks contrast. So it just becomes a general visual problem. That maintains, by the way, even in low light conditions. You still want a clear media even when you're looking at low light. And this is something that's pretty easily measured by the point spread function. So when you look at a point source of light and it goes back to the retina, it of course will spread in the optical media. And depending on the amount of that spread, you can measure the scatter in the eye. So what you can do is what's called a 2-point threshold. You can make 1 point and separate these. And as they separate out, you can see how much scatter, a very easy method of measuring scatter within the eye and some of its wavelength characteristics. And so scatter is a pervasive problem. So consequently, maybe not surprisingly, we have a yellow filter in our eye that can absorb a lot of that scatter and affect visual function as a result. One way that this is quantified in the lab is by this kind of stimulus. So you have two ways in the clinic of measuring glare disability. Either you can induce glare by varying the intensity of the glare source, or you can keep the intensity of the glare source constant and vary the target. What we do is vary the intensity of the glare source, which is, I think, the more ecologically significant way to do it, but also the much harder way to do it. So what we do is we increase the intensity of this annulus. That scatters within the media. That will occlude a target, and that's the glare disability threshold. When we've done that and measured the amount of macular pigment in the retina, we've found very strong correlations between the two. And this now is, I'm showing just our data here, but this has now been done in a number of studies. And we can supplement the lutein and zeaxanthin over 6 months, and as lutein and zeaxanthin go up, visual function is concomitantly improved. One nice thing about this area is that we can actually supplement and see if we can produce a change. So it doesn't have to all be cross-sectional correlational data. We can actually change something and measure the outcome. That was one reason why it would have been a good thing to measure macular pigment in the ARID study. Then we could have very specifically related the change at the retina, to the change in visual function. Now, one probably mechanism for this effect is, as I implied, just pure filtering. This was a study that we did a few years ago where we implanted a yellow IOL in one eye and a clear IOL in the other, and then measured glare disability thresholds. And the eye that had the yellow IOL had a better glare threshold than the eye that had the clear IOL. So that was a nice contralateral design, so within subject control, suggesting that filtering is the locus of the effect. Another thing we did is we varied the nature of this source. So if we used longer wave light or mid-wave light or red light, lights that are not absorbed by the macular pigment, you don't see the effect. It's just flat. So that makes sense ecologically. You don't usually encounter short wave deficient light in nature. You encounter things like the sun, which has a lot of short wave energy. Now, another glare-like effect is sometimes called photostress recovery. In this case, what you do is you take your patient, you blast them with light, which is essentially blinds them, and then you measure how long it takes for them to see again. That's photostress recovery. And that's a really that's a nice prognostic because it's mediated both by the optics of the eye. It scatters more, you're going to get more photostress, but also by the pharmacokinetics of the retina itself, how fast visual pigment reforms, how fast it adapts. So it's been shown to be very reduced very early on in conditions like macular degeneration. Again, if you supplement individuals for some time and follow them over a period of time, as their macular pigment goes up, their photostress thresholds go down. And in this study, it was about 5 seconds. We just did another placebo-controlled study and had even a more enhanced effect. And 5 seconds might not seem like a lot, but if you're driving 60 miles an hour or kilometers an hour, whatever that is, whatever, and you can see 5 seconds sooner. That's the difference between an accident or not. So that was a pretty significant effect. Again, we can just see those with yellow IOL, suggesting it's a filtering effect. If you measure the seconds in a clear IOL versus a yellow IOL, you get a good reduction in photostress recovery. So it's less photopigment bleached, et cetera. You'll get a recovery. Now another idea, again a sort of old idea that was posited a long time ago for what these pigments might be doing in the retina, is reducing the effects of blue haze. And how the basis of this is just simply the phenomena that if you look at what limits vision in the distance, how far we can see and how well we can see distance images at a distance. And remember that a lot of our sort of modern eye conditions are based on how we use our eyes now. We're always doing this. But it's, I love to tell my son how unnatural it is to read for a very long time because he really gets into that idea that, this is something new. After all, the printing press wasn't around until the 14 or 1500s, and then books were very rare. So we haven't been using our eyes like this for a long time. Most of what we did was vision in the distance. We were agrarian or hunters and gatherers. And so how to see on really hazy days became the issue. So if you take this image and, the change in particulates and relative humidity, it'll impair objects in the distance. When here's just another example of increasing haze of the same image. It's going along, and you can see that haze in the environment really degrades visual acuity. The sky's the same way. I mean, there's a reason we have this pretty blue sky right now. If you measure the spectral composition of skylight, the very peak, it's Rayleigh scattered light, but the peak is actually exactly 460 nanometers, the peak absorbance of the macular pigment, and that's probably not coincidental. So when they've measured skylight, this is skylight, and this is blue haze, the absorbance spectrums of the pigments line up very, very well. So one idea is that if you have an image that's hazy and it's projected onto the retina, that you have the object you're going to see imposed with a bunch of haze, and that's projected together onto the plane of the retina. And if you have a little yellow filter in front of your photoreceptors, that'll filter out the degrading haze component, and you'll see the object behind it. And one data we're going to be presenting in a poster tomorrow is data on that specific idea. One example of what we've done recently was we created basically macular pigment goggles. And we had patients that were adjustable. And when we did that, and we took people with relatively low macular pigment, we could improve their visual range by about 20–30% by adding filtration. So that's data. Now another example of something an optical effect these pigments could have is contrast enhancement. We live, whenever you look at images at a distance, one thing that's lost is luminance information. Works great with a Snellen chart because you have a black letter on a white background. But whenever you look at images at a distance, as they travel the distance to your eye, luminance information is lost. That tends to equalize. I could take a very good spectral radiometer and measure luminance differences on distant objects, so you don't get much luminance difference. But what you do get is you get chromatic differences. And so if you can enhance those chromatic differences within the eye itself, that enhances contrast. So if you take the example, say, of a baseball on a blue background, if that image is projected to your retina, and you have a yellow filter, and it absorbs the baseball or the background, more than the baseball, it enhances the contrast. And remember that you don't have to enhance contrast very much to have a visual effect, because the retina itself is a sort of contrast engine. It's designed to enhance edges. So if you stimulate just a little bit, the retina will make those edges even more visible. So lateral inhibition. So we live in a world with lots of chromatic edges. So the idea, and by the way, there's been a number of really nice primate studies that looked at the kind of chromatic edges we encounter in the world. Because anytime you have a colored filter, you're going to enhance some chromatic edges and actually degrade others. So it could just be sort of shifting our vision to a different point in CIE space. But when they've done ecological studies of the kind of chromatic borders that primates, including ourselves, encounter, they're really shortwave dominant. So it does seem geared to the kind of chromatic edges that we have traditionally encountered. One way that we looked at this initially was to use a technique called the minimal border technique. So what you do is you take two chromatic wavelengths and you look at them side by side, and then the subject adjusts one to match the other, minimize the border. And when we do that, and we give them a variety of wavelengths to match, they pretty much follow the absorption spectrum of macular pigment. So that was good evidence that it was the macular pigment itself that was enhancing the border. We've also just done a number of cross-sectional studies, just looking at chromatic borders, and now an interventional study, and shown that indeed it has this border-enhancing quality. Now, given all that, why bother increasing your macular pigment at all? If these are all sort of optical effects, why can't you just wear yellow spectacles? And in fact, yellow spectacles seem to be pretty popular these days. And if you look in sports, you can see all kinds of, even Brad Pitt and Angela Jolie wear yellow spectacles. So it's obviously very cool. And sharpshooters wear amber goggles, and archers wear amber goggles, and pretty much they have a widespread use in sports. In fact, one of the booths you'll notice is advertising lenses for golfing. And in fact, these lenses are very specific to the sport. You can get contact lenses. By the way, these look extraordinarily weird when you have colored contact lenses that cover your entire sclera and your iris. They give you that sort of weird alien appearance, but it's still the case that a lot of sports professionals wear these things. So why not just do that? There's a few reasons. One reason is that they always have to match the illuminant. So because they're just a static filter, they don't work well in all illumination conditions. And of course, in illumination conditions, rapidly change. You have bright sunlight, dim light in the evening. So illuminants are constantly changing. The yellow filters themselves are constantly changing. I wrote a paper last year on all the studies that looked at strategic filtering, often yellow spectacles and such, and their effects on visual performance. And the results vary across the board. Some studies find huge results. And the Air Force, by the way, does a lot of this because they want to enhance the vision of their pilots. And so there's a long history of studies like that. Even visibility issues are big in diving. So they want to put strategic filtering in the lenses of divers. So the problem with them, though, is that in 90% of the studies that I reviewed, they never specified the nature of the filter, nor did they specify the nature of the illuminant. So that's two sort of varying factors. And just because it looks yellow doesn't mean it has even close to the same spectral conditions. The other problem, of course, is that the intraocular filters themselves are dramatically varying. So you have a widely varying lens. So babies have lenses that are transparent even to ultraviolet light. They actually look a little blue. And then, of course, they change as it opacifies through life, it changes. And that's extremely variable. I mean, you look at this older group, it goes from people with cataracts that are almost clear to extremely dense. So there's just huge variation in the lens. And that affects that bottom third of the visible spectrum. There's huge variation in macular pigment. These are individuals. This individual has an optical density near 1.4 at the peak. Think about that, by the way. If you have a macular pigment optical density of 1.4 at 460, a dense lens at 460, that's, you can get up to almost 2.0 optical density of intraocular filters in your eye. Now add some more yellow filter on that. I mean, there's no light getting to your eye at all. At 1.4 at 460, you're only getting 1 or 2% of light at 460 anyway. So there's no illuminant left, So all these factors are varying. So if you put all those together and add them together, obviously the effect on visual function itself is going to be extremely variable. So that's a big issue. Now, why isn't that an issue with macular pigment itself? If you have a huge amount of macular pigment in a kind of yellow lens, which is pretty much knocking out the bottom third of your visible spectrum, why doesn't that have a big effect on visual function? There's a couple reasons. One reason is that the lens and macular pigment are a little bit off the photopic spectrum. Most of your spatial vision in normal life is mediated by the mid and long wave cones. If it was mediated by the shortwave cones, heterochromatic flicker photometry would not work. You don't even have shortwave cones in the very center of your retina. So it's most spatial vision, most flicker perception, all those things are midwave and long wave mediated. And so macular pigment doesn't really absorb much of the usable light in the middle of the luminosity function. Neither does the lens. They're off-center. Now that's true of the photopic spectrum, your day vision. Less true of your night vision. When you go through that Purkinje shift and you're in your scotopic functions, macular pigment absorbs a lot more of it, which makes it surprising, by the way, that it doesn't affect night vision. So if you measure, say, mesopic acuity, this was done in a study a few years ago, actually macular pigment improves mesopic acuity. It actually improves scotopic sensitivity, ironically enough. So one question is, how does it do that? Why is it the case that if I have a lot of macular pigment, I don't have a big dark spot in the middle of my vision? In fact, why is it the case if chromatic aberration in the eye is so bad, at 460 you're about a diopter out of focus? Why doesn't everyone have little blue fringes around objects on a sunny day? How does the visual system compensate for all those distortions? And the answer is that the eye is not a passive detector. It's not like a camera. It's hooked to the brain. And the brain corrects for all kinds of visual distortions. And anything that's constant. It can correct internal elements of the eye. It can't as well correct external elements. So if you wear glasses, that's a very different thing than having an internal yellow filter that the brain can correct for. Here's just a few examples of this. I knew that at this point in my talk, I would be looking at a lot of sleepy individuals. I can tell I'm starting to fade. So I'm going to juice it up now for a minute. So this is a common visual illusion. So if you're looking at it, you see all these circling bars here. This is an illusion based on how your eyes scan images. So whenever you look at something, even though you might not be aware of this, you're scanning it. So you start on one side and you go scan, 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 scan. That's how your eyes always look. So if you keep your eyes focused just on one little point for a moment, you'll notice that the circle stop. But what you don't notice is how your eyes scan. Your eyes are always scanning. So that creates that. It's based on eye movements, but you don't notice your eye movements. As I'm walking around, my eyes are moving to compensate for the movement of my body. Otherwise, my visual perception would be like a bad movie. It'd be like one of those home movies that knocks around all the time. But my eyes are also connected to my vestibular system, which monitors gravity and the movement of my body and corrects for movement of my body. That's why you have that autokinetic effect. When you have a car that backs out beside you and you feel like you're moving forward, just slam on your brakes. The two are, you have visual input to your vestibular system, just like your vestibular system has visual input to your eyes itself. Here's just another example. This was a study that was done on the campus at Harvard. And what they did is they measured eye movements of people looking at this and the parts of the image that was in focus and the parts that aren't in focus. And it's a funny thing to remember that the visual image you see is not what's in your eye. What's in your eye in an image like this is something like this. You're scanning that image, so only a tiny little bit's in focus. You have a big optic nerve where there's a big hole. Your eyes are jumping in these saccades, so it's a big blur. It's got vitreal, floaters, so it's a big mess. Your eye takes that optical mess and makes the stable environment that you perceive. Obviously, these chairs aren't red. That's just a wavelength that's entering in my eye, and my brain creates the perception of red. So vision is a brain thing and has very, very active mechanisms for correcting for stable elements of the system that don't work with non-stable external elements of the system. Here's just another example. If you're outside, the light in this room, for example, is going on and off all the time. You're blinking, right? So if I turned the light on and off in this room in the exact manner that you're blinking, you'd notice horrifically the light going on and off. You don't notice it because your brain corrects for the visual input loss during a blink. And there was a very interesting study that showed this, by the way, that was done at Brown. I was a graduate student at the time, and they had to bypass blinking. So they took the visual image and put it on the back of the eye. So they make an optic probe. I was a subject in this experiment. Back behind your mouth, up through your thing, and shined on the back of your eye so they could bypass the blink. It was a very obnoxious experiment. But it makes the point, it's a brain thing. So not surprisingly, lutein is in the brain. Like I mentioned, it's in the cerebellum, for example. And when we measure balance time and the amount of macular pigment in the system, individuals with higher macular pigment have much better balance time. What that is, by the way, and you should try this. Step on one foot and shut your eyes. You should be able to do that for at least a minute, by the way. That's a very good biomarker of neural health. If you're going like this really quick, not good. Practice that. So, but individuals with more lutein in their system, better balance time. Like we said, we can measure, there's some data, this is just some early vision of this data, that if you measure lutein in the retina, it highly correlates to, this is the primate data, to lutein and zeaxanthin in the brain itself. So we have good evidence of this, and reflects other aspects of brain function. For example, this is temporal processing speed. If there's one underlying element to a lot of cognitive loss, it's neural processing speed. Just work on like an Excel file or something like that with an older person, and you'll know exactly what I'm talking about. You're like, let me do it. Those are too slow. It's like, so many things that are lost with aging have to do with slowed neural processing. And the basic reason for that, by the way, is neural loss. So if you give a young person an analytical problem and you measure brain function as they're solving it, their brain will go ba-doop, 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 ba-doop. But if you give the same problem to an older person, their brain goes ba-doop, 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 ba-doop. They have to use more brain to solve the same problem because they have neural loss, so they have to recruit all these adjoining neural areas, and it just makes the process slower. So one idea behind what carotenoids can do is that they link neurons laterally, and that enhances gap junction communication, sort of their ability to work collectively. And so when we've measured this processing speed, individuals with higher amounts of macular pigment in their system have faster processing speeds. And we've done this in a number of ways. We're going to present some new data on this at posters over the next few days, but here's just another example when we measured a coincident anticipation. And this is one that's a clinical measure of baseball performance. So you streak this light down this long track, and they have to hit a button when it gets to a target. So it sort of simulates batting in a laboratory. And when we measured that, first of all, it was highly correlated with the amount of lutein in the system. And then if we supplemented, we could get improvements in that kind of variable, less errors, et cetera. Now, let me end on just one final point, and that is that another feature of sports is that people get damage to their visual system. So one example is heading in soccer. I was trying to come up with some sports that English people would resonate with. I realized that I was using baseball as too much of an example, so I'm trying to segue into more English sports. But heading in soccer, and apparently you guys don't wear helmets here. Football means something entirely different, and we wear helmets, but you guys don't wear helmets. And when you bat the ball with your head, can cause some damage. And just a lot of English sports have a lot of abrupt contact. So, that's damaging. And one idea behind what lutein and zeaxanthin does, right, is it's an anti-inflammatory, it's an antioxidant. And one tricky thing about mild TBI, and this is traumatic brain injury, of course, very few of us haven't been hit in the noggin really hard at some point in our life. And if you're hit hard enough, of course, that's traumatic brain injury. And the immediate response to traumatic brain injury is inflammation. That's why, this business about don't let your child sleep after they've had a serious blow to the head. And one reason is that, your brainstem goes through an area of bone, your magnum foramen, this is very fixed. So if it inflames there, that can induce coma, et cetera. But mild traumatic brain injury, which is a very different clinical entity than traumatic brain injury, isn't so obvious to diagnose. And probably 20–30% of the soldiers returning from Afghanistan and Iraq in America have suffered mild traumatic brain injury. And so what happens is a sort of low-level inflammation, increased antioxidant stress, but the thing that really diagnoses them are visual dysfunctions. So you can see all these very characteristic, and there's been a number of volumes that are specifically looking at visual deficits that result from mild traumatic brain injury. One big one is slowed photostress recovery. Another big one is glare problems. Actually, ironically, a lot of these functions that we know are directly linked to lutein in the system. So one idea is to use this as either a prophylactic or a treatment for people with mild traumatic brain injury. Here's one we're looking at in our lab currently, and that is, this is called the Hermann Grid. And you can see these, I don't know if you can see them well blown up this way, but when you look at a pattern like this, you see little illusory spots. And why you see them is that you're positioning your receptive field over the various areas, so you're causing lateral inhibition effects in your retina, which cause these illusory spots. Well, individuals who have had recent mild traumatic brain injury or traumatic brain injury don't see those. In fact, the military is investigating using these as a very quick diagnostic to see if they've had clinically significant brain trauma. And so you can measure that as a visual aid to know if someone's recently had significant damage to the brain. So we're looking at that and how it's relating to lutein status itself. So I think I'll stop there and thank the rest of my lab, and thank you for your attention.